Okay, let's talk healthcare in America. With 48 million Americans without healthcare insurance, it's getting, a little nuts. And more than a bit scary. In Lakewood, New York, I interviewed Dr. Rudy Mueller. He authored the book, As Sick as It Gets, about healthcare in America. Dr. Mueller told me that the healthcare horror stories are many. One of his patients got a cut on her leg. It got infected. She didn't have healthcare insurance and put off coming into the office. Gangrene set in. By the time she came in, the leg had to be amputated. This has to change. And some of this has to change on the front end. That is, I told the Salinas, Kansas Journal that common sense says if people ate more nutritious food, got more exercise, and were less stressed, well, they wouldn't get sick as much. Again, common sense. So our administration would put a lot more energy into prevention. And besides a focus on more exercise, more nutritious food and the like, we'd also zero in on things like preventing pollution. At Oberlin College in Ohio, I interviewed David Orr, who's the head of the environmental science department there. He told me carcinogens in auto exhaust, factory emissions, paints, cleaning fluids, crop herbicides, and pesticides are creating chemical cocktails in our bodies that cause things like cancer. You know, we're forever racing for the cure, but shouldn't we actually be racing to stop using the stuff that causes cancer in the first place? Again, common sense. Now granted, some people are still going to get sick. So how do we address this as equitably as possible so everyone has access to quality health care? While in Alabama, I interviewed Auburn University professor Renee McEldowney. She teaches about economy issues around healthcare and has traveled internationally to research other healthcare systems. For instance, she studied Holland's socialized healthcare system and said it has little waste in comparison to, say, America's healthcare system, where 30% of costs are about, quote-unquote, pushing paper. That is, all the money that goes into advertising, public relations, insurance paperwork, etc. Now, while Holland's, Canada's, etc. national health care for all seems attractive on the surface, we believe this would set up yet another absolutely gargantuan federal program centralized in D.C. Our administration instead would recommend the establishment of a regional healthcare system that contained much of the spirit of a national healthcare system in regard to everyone having access to quality healthcare. This regional healthcare system would include a local tax that would go into a pool to cover a local version of Medicare and Medicaid for low-income uninsured people. This would be administered by regional governments. As this system was phased in, we would propose phasing out the national Medicare and Medicaid programs, evoking a shift to more local concern for local people. However, in the poor areas of the country, we realize that a regional area's tax base might not stretch far enough when paying for everyone who needs health care. So as a supplement, we propose a series of community initiatives from county to county that would include components from some of the following grassroots healthcare models we've researched. For instance, in Monroe, Louisiana, we interviewed Cindy Smith, who is on a pharmacy board for a quote-unquote community pharmacy in this town. The pharmacy, which is a nonprofit effort coordinated by the local chapter of the St. Vincent de Paul Society here, provides affordable medication to low-income people in the area. The pharmacy gets financial donations from the community and beyond. It also receives donations of sample medication from area doctors and leftover medication, often from area nursing homes. In his own War on Poverty, Dr. Myron Glick has rolled up his sleeves and moved his Jericho Road practice and his family into the heart of the inner city of Buffalo, New York. With Buffalo being a port city, there is a tremendous concentration of new immigrants here. He's seen people from 50 countries so far in his practice. On a stop in Buffalo, Dr. Glick told us he's a Mennonite and believes his faith calls him to help the poor with the talent God has given him. He operates on a minimal sliding fee scale, doesn't turn anyone away, and his work has inspired some suburban doctors to come into the city regularly to volunteer at his practice. The Medical Care Access Coalition in Marquette, Michigan believes everyone should have access to quality health care as well. On a stop there, Dr. Fritz Honke told us the coalition provides medical care and medication for low-income, uninsured people at little or no cost. He said most doctors in the area are involved and patients are screened for financial assessment before becoming involved in the coalition system. The uninsured in Grand Junction, Colorado are also taken care of by local people. On a stop in Grand Junction, Dr. Carl Melita told us local doctors and nurses volunteer time at the Marillac Clinic, a 2-story hospital with complete services. Likewise, other local people volunteer as intake workers, secretaries, janitors. What's more, regular fundraisers keep the clinic afloat. Dr. Melita said not only do the uninsured of the country here get medical help, but the intangible as far as town camaraderie goes is that they also get the assurance their neighbors are concerned about their welfare. We have to remember, yes, it's about everyone who needs the medical help getting the medical help, but there's another dimension. It's about creating a system to provide as many opportunities as possible for local people to help. In this, local camaraderie does indeed grow significantly, and it is in this helping that many people of faith, for instance, grow spiritually. It's a win-win situation.